Now, joining me via Skype is Dr. Tolu Olufunlayo, Chairman, Association of Public Health Physicians of Nigeria, Lagos. Thank you for joining us on TVC Breakfast.
Thank you.
Now, according to the reports we got from Kano, diabetes, meningitis, and the likes were the causes of the rise in cases of deaths recorded. And the team there, the NCDC team there, according to the reports, also said that they based this findings on verbal autopsy. Talk to us about how effective verbal autopsy is as a public health specialist with regards to investigations into viral infections and deaths of this magnitude.
Thank you very much for having me. Well, as regards verbal autopsy, it's what you use when you can't do an actual autopsy, which is, checking the person after the person has died to try to ascertain what caused the death. However, in Kano State, we've been hampered by not having testing going on due to some of the challenges that arose after the first few cases of coronavirus. And I think with that, the best that can then be done is a good history of each of those cases. Going forward, however, now we are resuming testing in Kano, I learned today. And I know quite a lot of resources, both human and material, are being moved down to Kano and to other northern states to support, what is going on there. We just need to get to the bottom of the matter. And since we know that there is coronavirus disease raging or ravaging the communities, we have to ensure that we control that nonetheless, even if there are other ongoing circumstances, other ongoing illnesses, that prevail at this time. So all of them have to be managed, using the different strategies that they require.
Now, with the fear of community spread, talk to us how the state could engage community communicators to really help address this issue with regards to community spread and perhaps flatten the curve within the state.
Okay, well, I know that there are several strategies already, in place. The NCDC has launched a campaign, Take Responsibility. So what we need to do now is to domesticate these messages. The way that message would be passed on in Kano State will probably be different from the way it would be passed on in Lagos. There are different socio-cultural, ethnic, and religious differences that would make the means of engagement peculiar to that environment. So what needs to be done quickly is to be able to engage the community and gain their confidence, gain their understanding of the disease, and gain their cooperation in mitigating it, such that they can social distance and imbibe other public health practices that will be able to slow down the spread of this disease in that area.
Now, we see countries like Senegal and Madagascar coming up with some sort of solution to COVID-19. What lessons can we learn from these countries that we can perhaps put into practice as a nation?
Well, we just need to strengthen our health systems in all ramifications. If we had developed our alternative medicine sector very well, at this point in time, it would be easy for us to look inwards. So we now have to, strengthen all aspects of our health system so that we can have homegrown solutions and not wait for the West to give us what works for them, because what works for them does not always work for us.
And also moving forward now, what would be your message to perhaps Nigerians in general, talking about taking charge? Because the government might make its own effort, but Nigerians also have to complement that.
Well, thank you. There is indeed a message. Nigerians must take responsibility. For them to take responsibility, however, they need to understand that there is the disease, that COVID-19 is real. And this is where community engagement and community influencers come in. So when we engage adequately at the local levels, then we can get Nigerians to comply without necessarily enforcing social distancing. They would look for, means of practicing hand hygiene. If we say wear masks, we won't need to make people wear masks only when they see law enforcement agents, just like, in the issue of seatbelt use, where people used to rush to put on their seatbelts only where they see the traffic warden at the junction. We want people to do these things willingly because they know that, well, my life and the life of the next person depends on this action. So we really must get Nigerians to understand and let every one of us work together in partnership to be able to get this disease to slow its transmission.
All right, Dr. Tolu Olufunlayo, thank you so much for speaking with us. Joining me via Skype is Dr. Tolu Olufunlayo, Chairman, Association of Public Health Physicians of Nigeria, Lagos. Good morning, and thank you for joining us on TVC Breakfast. Let's start with how concerning the case of Kanu is for you. The president has decided to isolate Kanu in his speech yesterday, talking about a lockdown in the state. Before we go to the measures to take, tell us how concerning these cases are.
Oh, thank you for having me on your show this morning. Well, it's definitely a concern because, for one, there's been no testing in Kano for some time, which means we don't really understand the true picture of what is going there. Secondly, there have been a lot of unexplainable deaths, and this needs to be looked into as soon as possible. And before testing stopped, we saw a sharp rise in cases in Kano. So I think the government has taken a good step because really what a lockdown does is it tries to slow transmission as well as give time to investigate and find out what exactly is going on. And so I think this is what is going to take place in Kano State over the next several days.
So are you saying that if testing had started earlier than when it did, that perhaps the cases we are witnessing, the things we are seeing happening in Kano wouldn't have?
Not necessarily, but then at least we would have known what the problem was and would have been able to design measures to begin to mitigate it. So probably we wouldn't be where we are today. Right now, we can't say exactly what is happening in Kano for sure, for certainty, because we don't have the information, we don't have the data.
So now the scare has been the aspect of community spread across states. That is one of the major reasons for the enforcement of a lockdown in the first place. Now that the federal government is wading into seeing what measures can be taken to curb the spread of COVID-19 in Kano State, what are the ways or strategies that you expect the government to put in place to address issues of community spread with regards to the number of the population, rather, in Kano State?
Well, as we've said severally on different fora, it's a very difficult situation. It's a delicate balance that needs to be achieved. So I think the very first thing, like I said, is they would need to, determine exactly what is going on, and that would be by, doing testing and looking into the previous activities of the last few days or so in Kano to be able to understand what is going on. I think that's very, very important. Having done that, there are standard public health measures that need to be instituted to flatten the curve, i.e. to reduce, the rate of transmission and also to reduce contact to, reduce the spread. And these we know. We talk about hand hygiene, respiratory etiquette, and then social distancing, of course. And we're now talking about the use of masks compulsorily in public places, also to reduce the spread of infection from one person to the other.
But we saw the kind of reaction that trailed the hand washing, the social distancing. A lot of persons have come out to say that this is not as Afrocentric as it seems to be that it is something, perhaps, if I may use the word, something borrowed. If we are to look at something that is Afrocentric, when you look at the nature of the population and the persons in Kano, social distancing might be very, very difficult to achieve.
I agree with you. However, if something is important, then we need to find ways around it, ways that make sense. I think one of the things that we really haven't done enough of is to engage the communities. So if we're living together and there's so many people living in one place that it's difficult for us to actually distance ourselves, then how can we prevent the disease from spreading? The individuals themselves, I mean the communities themselves, if they are engaged and they understand the danger of this illness, they would come up with solutions that can work. So that is what we mean when we say Afrocentric solutions. We need to tailor these borrowed solutions to our own environment. And one of the ways of doing this is by engaging the community. They are brilliant enough. If we engage them, they'll be able to show us what we can do. And we'll also get more cooperation from them in doing whatever we want to do.
All right, Dr. Tolu Olufunlaya, thank you for speaking with us.